Hi everyone, this is Dr. Constance Benson. I'm the Program Director for the Division of Infectious Diseases and Global Public Health ID Fellowship Training Program. Today I'm going to review for you the introduction to our program, and this will be available for you on our website so that you may review it at your leisure as you're preparing for your interviews. The UCSD ID Fellowship Training Program leadership is depicted on this slide. That's me, Dr. Benson, the Program Director. I'm accompanied in the leadership by Dr. Darcy Wooten, who is our Associate Program Director, and by Meredith Lococo, our Program Coordinator. You've all heard from Meredith about arrangements for your interviews, so hopefully you will find this a useful adjunct. I like to start our introduction by going through our fellowship training program mission statement. I'm sure most of you are bored by things like mission statements, but the only point I want to highlight in our mission statement is that the goal of our infectious disease training program is to provide both outstanding clinical and research training in the field of infectious diseases and to train the future academic leaders in our subspecialty. We offer a superior academic environment with diverse clinical, educational, and research opportunities. The Division of Infectious Diseases and Global Public Health is the result of a merger of three major areas in our Department of Medicine in 2017 and 2018. We merged the Conventional Division of Infectious Disease with the Division of Global Public Health and the section of HIV Medicine and Owen Clinic into a single unified academic division. We continue to maintain three separate sections within our division so that leadership can be focused on each of these three main areas. The ID and Global Public Health Division is the top research division in the Department of Medicine here at UCSD. Our annual NIH-sponsored research grant funding base is more than $30 million per year, as in, I guess, a fortunate byproduct of the unfortunate COVID-19 pandemic is that our NIH-sponsored research grant funding has increased exponentially related to funding to support COVID-19 research. The division is widely recognized for its achievements in basic, translational, clinical, epidemiologic, and socio-behavioral research. Our particular fields of interest are in HIV, and this spans the full spectrum of all of these research types within the field of HIV, in basic and translational virology, particularly herpes viruses, parasitology and tropical medicine, bacterial pathogenesis, in particular multi-drug resistant organisms, and public health epidemiology and global health. A little bit about the UCSD School of Medicine and the UCSD health system. Much of this information has been reviewed for you in one of the other videos that we recorded for your use and is posted on our website. But the UCSD School of Medicine was founded in 1966 as one of the University of California's major research universities. As you all know, the University of California is the largest public university system in the world and is currently ranked #1 in the world as major public universities. UCSD School of Medicine is ranked 8th in total NIH funding among U.S. medical schools, and we're the third highest supported among the California medical schools. We're the only university academic healthcare system in the San Diego area with more than 1,500 faculty members. We have a very large School of Medicine. We also serve a diverse patient population in San Diego County and along the border area with Mexico. Our influence and programs span the full spectrum across San Diego County, and we stretch those programs with affiliations nearly to the Arizona and Nevada borders and north to Los Angeles and Orange County. We have 65 postgraduate training programs sponsored by UCSD Health. And so we also provide a very rich training environment here in San Diego. This slide depicts some of the major strengths that we consider to be involved in our ID training program. I've talked a little bit about the diverse patient population, and this also adds to our strong clinical programs. The diverse patient population, spanning the large geographic area that I previously mentioned, includes people from northern Mexico and Baja California. We also have an affiliation with several major Pacific Rim universities and organizations. So we have a large and diverse Asian population or Pacific Rim population that we serve. We, being a border healthcare facility, we also provide border health and a lot of healthcare for refugees and immigrants and the populations that traverse the border. The border with northern Mexico is the busiest border port in the United States, with nearly 800,000 to 1 million border crossings per year. And that doesn't mean illegal crossings. These are legal crossing with people who may live in northern Mexico and come to work in San Diego County, or people who may live in San Diego County and work in northern Mexico. And there's a lot of commerce, a lot of educational activities, a lot of healthcare activities that traverse the border with Mexico, and we are a large part of that. We also have highly accomplished faculty with diverse research and clinical programs that are focused on the major areas that I've already highlighted for you. A couple of additional things to point out as strengths of our training program are the recently funded Center for Innovative Phage Applications and Therapeutics, or IPATH. This is a center that was successfully competed through one of the chancellor's opportunities for funding and focuses on developing bacteriophage treatment as an adjunct for multi-drug and extremely drug-resistant infections. And these include bacterial infections and mycobacterial infections as areas we are currently working in. Our faculty are very dedicated to fellow teaching and mentoring. We have 2 T32 NIH training grants that support fellow research activities. This is important because these training grants provide supplemental salary support for second and third year fellows as they work their way through research training. And they also support attendance at conferences and supplemental training that I'll get to in a moment that expand our ability to provide dedicated research training for fellows who are interested in pursuing these. We also have 2 formal tracks in our program. We have the ID Academic Research track, which is a 3-year program, and a Clinician Educator Leadership track, which is a 2-year program. Within these 2 formal tracks, we have 6 research or clinical training areas of emphasis, and these include emphasizing basic science research, clinical investigation, and individuals involved in either track can do additional training in clinical investigation, in global health, public health epidemiology, HIV medicine, transplant ID, and infection prevention and clinical epidemiology, which also includes antimicrobial stewardship. We just recently added the Clinician Educator Leadership track and have put together a formal curriculum for this, which we hope will expand some of the opportunities for training for fellows interested in coming to our program. Many fellows during their interview process ask about supplemental training. We have a number of avenues for achieving supplemental training activities over and above those offered in our ACGME accredited training program. For the first of these is the Clinical Research Enhancement through Supplemental Training, or CREST course. This is a patient-oriented clinical investigation training program that is based on modular self-study courses over a 2-year period. If these modular self-study courses are combined with research project potential, with a research project, these have the potential for fellows achieving a master's degree in clinical investigation at the completion of the 2 years of supplemental training. Many of our fellows avail themselves of the opportunity to engage in the CREST course. Some go through the entire 2 years during their second and third year of fellowship and achieve a master's degree in clinical investigation, while others select individual modules such as epidemiology, biostatistics, patient-oriented research to supplement their ongoing research training or clinical training in these areas, and this can be done relatively easily as well. For those interested in a more basic science supplemental training, we have through the graduate school coursework available in virology, immunology, molecular biology, basic sciences, and bioinformatics. And this is something that can be built into your research training program in the second and third years. We also have partnerships in public health with San Diego State University School of Public Health. We've also recently formed a UCSD School of Public Health, which currently is virtual, meaning that we don't have a brick and mortar building that houses our School of Public Health, but we have a new dean and faculty that have just joined this School of Public Health and are beginning to focus new programs in this area. We also have partnerships with San Diego County Department of Health, where coursework in epidemiology, in epidemic investigation, and other areas of public health can be part of an individualized training program for fellows who may be interested in this. We have had fellows who have received an MPH through San Diego State during their fellowship. We have the opportunity of having this happen now with our own School of Public Health, and obviously supplemental training through the San Diego County Department of Health courses is something that can be built into your program as well. I just want to take a moment to highlight some of our global health programs for our fellows who may be interested in pursuing global health. You should be aware at the moment that with the COVID-19 SARS-CoV-2 pandemic, our university has restricted travel for fellows in training, so we're not able to send fellows outside of the country to engage in global health programs. However, when these restrictions are lifted, I would like to point out that we are engaged in a number of global health programs outside of the U.S. that encompass the Pacific Rim and Southeast Asia, with programs in China, Korea, India, Bangladesh, in Central and South America with very large and multidisciplinary global health programs in Mexico and Brazil, and in sub-Saharan Africa. Mozambique is a particular area of interest for us. We have a long-standing partnership with the University of Eduardo Mondlane and the Maputo Central Hospital for the study of HIV, TB, malaria, point-of-care diagnostics, and implementation science. And we've been responsible for research training and capacity building, both through the original partnership with the NIH and the PEPFAR program for the Medical Education Partnership Initiative that was led by Dr. Schooley and myself, and now with 2 D43 research training and capacity building grants from the NIH Fogarty Center that are based in Mozambique. We also have programs in South Africa that are focused on HIV and tuberculosis in Johannesburg and Durban. We have programs in Zimbabwe that are focused also on HIV and antiretroviral therapy, and programs in Zambia and several other sub-Saharan African nations. Several of our fellows have also worked on epidemic diseases, not in sub-Saharan Africa, but in Western Africa. And those have been very interesting activities focused on Ebola and hemorrhagic fever virus infections as part of research programs that those fellows engaged in. So we have a very healthy and diverse global health program for fellows who may be interested in pursuing this as a career. I also want to take a moment to highlight some of the COVID-19 response to the pandemic that has taken place in our institution. Obviously, every institution in the United States has been impacted in some way by the pandemic, and this has spilled over into research and clinical training and education activities as well for every academic medical center. We've had to transition to and are beginning training in telemedicine and virtual patient visits for our fellows in our outpatient ID and HIV clinics. We have a dedicated COVID-19 ID outpatient clinic and a registry that are being led by two of our faculty members to see, and they have currently seen more than 500 to 600 COVID-19 outpatients as part of that program. We have a COVID-19 inpatient consult pager and a pager that we transition to different faculty to provide advice and consultation on the remdesivir emergency use authorization program and other antiviral and anti-inflammatory therapies that may be necessary for people who are hospitalized with COVID-19. We have a specific dedicated staff working on COVID-19 infection control and surveillance. They lead a staff testing program, the symptom screening program, and a series of smartphone applications that are part of that symptom screening program. And they follow up with stable and robust personal protective equipment surveillance for new cases in the inpatient and outpatient setting. Dr. Toriani and Dr. Abeles lead this program and are heavily involved in the infection control efforts to contain COVID-19 in our San Diego County area. We also have a number of COVID-19 research activities in which we are engaged. In the laboratory and through basic science and basic virology, several of our faculty are leading the studies of the pathogenesis and immunology of the immune response related to COVID-19. We've been involved in novel drug development and novel diagnostic development in our microbiology laboratory. Clinically, we've conducted a number of interventional clinical trials of new and novel drugs and immune modulators and broadly neutralizing antibodies. These are being conducted in partnership with the NIH and the Operation Warp Speed program, or the ACTIVE program. And we are engaged in these activities both in the inpatient and the outpatient setting. We also have studies ongoing through industry partnerships, and numerous of our faculty are heavily involved in leading these efforts nationally and internationally. We're also a part of the COVID Prevention Network, or CoVPN, and are leading the vaccine efforts, also in partnership with the NIH and Operation Warp Speed. We currently have 3 large-scale clinical trials of various vaccines ongoing in our institution, including the Moderna vaccine, the AstraZeneca vaccine, and the Janssen J&J vaccines. We may have other vaccine trials in the near future. And lastly, we're involved in the epidemiology and testing strategy. Drs. Schooley and Natasha Martin have led the Return to Learn program for the entire university, helping to bring back undergraduates and graduate students to UCSD campuses through a very novel epidemiology, modeling, and testing program. We're also involved in border and refugee health related to COVID-19, with opportunities to engage both in providing healthcare and in monitoring and surveilling COVID-19 outbreaks at the border region. So we have a very multidisciplinary effort ongoing as part of our COVID-19 response here at UCSD. I'll just move on now to talk a little bit about the general fellowship structure. In year 1, which is the clinical year for our fellowship, we have monthly inpatient consult block rotations. Our rotations make use of 6 different inpatient consultation services. We have a general infectious disease consult service at UCSD Hillcrest, a general ID consult service at UCSD Jacobs, a hematology oncology and bone marrow transplant ID service at Jacobs, a general ID service at the VA Medical Center, and a solid organ transplant ID service, which spans Jacobs, most of the services at Jacobs as well. And then lastly, a dedicated HIV medicine inpatient service at UCSD Hillcrest. So our fellows do anywhere from 1 to 2 months throughout the year in at least in each of these 6 inpatient rotations. While they are on the inpatient rotation at one of the 3 major medical centers that we utilize for teaching, we also have fellows attend outpatient ID clinic during those rotations. We don't have you in a specific ID clinic in a dedicated geographic location because we feel it's important, at least during the first clinical year, for you to be able to follow inpatients into the outpatient setting, to be able to observe the natural history and the treatment outcomes of patients that you see in the inpatient service. And the best way to do that is to have you attend ID outpatient clinic at the institution where you are completing your rotation on the inpatient services. The same faculty staff our ID clinics as staff our inpatient services, so it's really a fairly seamless opportunity to see and follow your own patients as you see them in the hospital and then again in the outpatient setting. We also offer weekly didactic core lectures on Tuesday mornings. These are all done virtually now in the COVID-19 pandemic era. We have microbiology rounds every Tuesday, Wednesday, and Friday on each of the inpatient rotations. This is a 1-hour conference that's led by the leadership of our microbiology departments at the university and at the VA Medical Center. And they present interesting cases from your consult services and go over the microbiologic workup of those cases. And these are also done by Zoom, but with a teaching microscope so that you can actually see plates and slides and go over the microbiologic evaluation for cases that you're seeing on your inpatient services. We also have a weekly ID case conference that the first year fellows present the first half of on Thursday afternoons, and then built into your first year schedule is a 2-week intensive microbiology laboratory rotation. That 2-week period is associated with morning activities at the microbiology laboratory benches and afternoon activities related to appointments with potential research or clinical mentors to set up what you may be working on in your second and or third years in the fellowship program. There are no clinical responsibilities during this 2-week rotation. The general fellowship structure in years 2 and 3 will depend on what track you are matriculating to. In the research track, year 2 and 3 are focused on working closely with research mentors on independent projects. And if you're in the clinician educator leadership track, year 2 is focused on specialty clinical and medical education training. However, all fellows will have a weekly HIV continuity clinic. This fulfills the ACGME requirement for 12 months of HIV continuity clinic, and we do this in our second year so that you will have time to do general ID clinics in the first year as I've previously described. You can elect to do your HIV continuity clinic either at the Owen Clinic on the Hillcrest campus or in the Special ID Clinic in the VA Medical Center. This is accompanied by a didactic HIV clinical curriculum to enhance your training in HIV medicine. And then you have the opportunity to tailor the rest of your training program focused on the subspecialty areas of emphasis or areas of interest for your own career development. And so whether it's research or clinician educator tracks, you can focus your research or further clinical and educational activities in any of the areas of emphasis that I've previously outlined. Each fellow has 6 weeks of inpatient consult service in the second year and 4 weeks in the third year, although those in the year clinician educator track may also have more concentrated inpatient consult service activities focused on the subspecialty area that you would like to pursue in your career. We also encourage committee participation through infection control, pharmacy and therapeutics, program evaluation, and graduate medical education. All of these have slots available for fellows to join and contribute. And then we also do journal clubs, work in progress, and research presentations throughout the second and third year of fellowship. So I'm not going to go over this in great detail, but you'll have the opportunity to see these slides on our website. But I wanted to just highlight a sample schedule for clinician educator track here in year one. Year one will look the same regardless of whether you're in the clinician educator or the research track. But in year two, you'll have more dedicated time to spend on specific clinical areas of emphasis and on medical education. And your continuity outpatient clinics may also expand to include some additional outpatient subspecialty clinics. The pie chart here just demonstrates how much of your time is spent in clinical versus non-clinical activities, with most of your non-clinical activities focused on either a research project, a quality improvement project, or medical education activities to enhance your clinician educator role. A sample schedule for the research track is highlighted here. And as you can see, the clinical year is very similar to the other track, but the years 2 and 3 are heavily focused on research activities to give you protected time to develop your own research projects and programs and begin to work toward a career in academic infectious disease related research. As we'll describe during your own interview processes, those research activities can span the full spectrum of anywhere from basic science, laboratory, clinical, epidemiologic, socio-behavioral, public health, and global health, or other types of research. And we can talk about that more in your specific interviews. Just a brief note on ranking the tracks. I don't know how familiar all of you will be with the rank order lists and how to do this, but in our program, applicants can rank their rank order list either in the clinician educator track, the research track, or both. If you're interested only in a 2-year clinician educator track, then you would use the NRMP code listed here. And if you're interested in a 3-year research track, or you're just not sure which of these tracks, you can actually apply to both of these and submit your rank order list to both. However, I do want to note that if you applied to only one track and would decide that you would like to rank in both tracks, please email Meredith at the time you're putting together your rank order list so that we can be sure to include you in both of our rank order lists. However, once accepted into a track, you are not able to switch, at least in the first year of your decision. However, we can later negotiate with you once you are in the fellowship program how we might be able to accomplish a switch if your career plans change. So don't be disappointed if you think that you can't change once you're accepted. Mentorship is an important part of our program. So all first-year fellows are assigned a faculty career mentor. All fellows are assigned to peer-to-peer mentoring families, and those we try to put together first, second, and third-year fellows to get together in a less faculty driven, more peer-to-peer mentoring programs, so that you have an opportunity to bond with your fellow fellows, so to speak, and get advice from senior fellows who have been through a lot of the same issues that you may encounter in your training. We also have a track-specific clinician educator mentor that we assign for individuals in that track, and a research mentor, obviously, for those assigned in a research track. For those who are working on T32 training grants, you will have a quarterly research panel presentation that is required as part of the T32, but also we will be providing through our regular ID case conference a quarterly research panel presentation that will highlight some of the different types of research programs being conducted in the division, and specific research mentors who are taking on fellows as mentors and are interested in recruiting you to work with them in their own programs and projects. And this is a way for us to make fellows familiar with and acquaint fellows with potential programs available in our division and research mentors who may be working in those programs. We also have research mentoring teams during your second and third year. And lastly, our program directors serve as career and research mentors throughout your fellowship training and are available to you at any time to discuss career planning, career development, issues you may be encountering, obstacles to achievement of your goals, and anything else you may wish to discuss. These are just some pictures of our peer-to-peer mentoring families. A lot of this is socially oriented. So back in the days when we didn't have to do social distancing, we could go to restaurants. Hopefully we'll get back to those kind of days in the very near future. But these are just some of our current and recently graduated fellows meeting together in one of our peer-to-peer mentoring programs. There are a number of opportunities to teach in our program. In year one, we have third-year medical students who do a 2-week rotation on general ID as part of their third-year internal medicine clerkship. They're available throughout the year, and we have specific teaching, attending, and teaching activities associated with that clerkship for the third-year students. We have fourth-year medical students and internal medicine residents and pharmacy residents who rotate with us on our inpatient consult services, and they too can provide opportunities for fellows to teach. In year 2 and 3, fellows can elect to serve as microbiology lab facilitators. These are individuals who teach in the microbiology lab for first-year medical students and pharmacy students. You can volunteer to serve as expert discussants at morning report, noon conferences for internal medicine residents. You can volunteer to support or work as a problem-based learning facilitator or small group facilitator for first and second year medical students in that part of their medical education. You can serve as a teaching attending for third and fourth year medical students who are rotating on the ID consult services, and you can participate in core didactic curriculum lectures, learning how to prepare and deliver case-based didactic curriculum lectures to your colleagues. This slide I won't go into in great detail, but I wanted to include in your packet as examples of recent fellow research projects. And as you can see, they are very diverse, with several of our fellows working in many of the areas that I've already highlighted for you. These also encompass fellows who are working in what would now be areas for the clinician educator leadership track, and each of these fellows has been successful in getting papers published and supporting their research with their mentors in their research programs. So I'll just finish here toward the end. There are a number of questions that always come up in our fellowship training program interviews about where are they now. And this pie chart just gives you an idea that 40% of our graduating fellows have been able to retain faculty positions here at UCSD. 29% have gotten ID faculty positions at other academic institutions. So as you can see, almost 70% of our graduating fellows have gone into academic careers either here or at other institutions. We also have 20% of our graduating fellows have gone into public health positions. We consider those to be academic as well. And 11% of our fellows have matriculated to private practice positions within or outside of UCSD. If you want to know specifically where individual fellows have gone, the slide presentation shows you where the last 10 years of our graduating fellows in terms of where they've wound up. Some have already gone through a couple of job changes over that 10-year period, so you can look through these slides at your leisure to figure out where people have wound up. We've had so many fellows who've graduated in the last 10 years that I've put these on to 2 different slides, but gives you a pretty good idea of where our fellows have wound up as they've finished. We currently have no unemployed fellows, which is a good thing. And our most recent graduates have all 3 wound up in academic positions at University of Maryland, University of Texas Southwestern, and University of Pittsburgh. So we're very proud of the positions that our fellows have attained. I'm just going to finish now by giving you a bit of an overview, although you'll get this on the day of your interview so that you'll understand how we're conducting our virtual interviews. We have elected to do most of our interviewing on Thursday afternoon or Friday morning Pacific times. These have been to accommodate time zones around the country for fellows who now will not be traveling but will be joining us on interviews on Zoom using the breakout room activities. We will start the day of your interview with a 15-minute introduction by the program directors and the program coordinator. This will be followed by 4 25-minute interviews with infectious disease faculty. You'll have a 10-minute break in between each interview, and then you'll be invited, if you're doing your interview on Thursday, to join the Zoom ID case conference after completion of your interviews so that you can get a sense of how our ID case conferences are conducted and what the fellows' participation might look like in those. If you are interviewing on a Friday, you will have the opportunity after the 15-minute introduction to start the day by viewing HIV and Global Health Rounds, another case conference opportunity within the division, again to see research in HIV and global health presented or clinical cases related to each of these before you start your interview process. And then that will be followed by your 25-minute interviews. As you will be assigned to a specific breakout room by our program coordinator as you start your interview day. You will not have to change to any different breakout rooms. Our faculty will come and join you in your breakout rooms when it's time for them to switch to a new faculty member for an interview. We've assigned the 10-minute break in between each interview to give some flexibility if the interview goes over a little bit, and to allow you, obviously, a biology break and some time to catch your breath in between interviews. We've also added a weekly Friday social hour from 5 to 6 p.m. Pacific time. This will be a social hour with our current UCSD ID fellows. There will be no faculty. We will be sending you a separate Zoom link, and this will be your opportunity to interact with our fellows and ask them questions about their own fellowship experience, to get advice from them about the fellowship and hear their perspective on their own training. The absence of faculty will give you the opportunity to have very open and transparent conversations with our fellows, and hopefully you'll all be able to avail yourselves of the weekly Friday social hour. If you're not able to do it on the day or week of your own interview, you will have the Zoom link and you'll be able to join the Friday social hour at any other time that's more convenient for you. Meredith Lococo will email you additional details about each of these before your interview day. And then obviously, like all of the other programs that you'll be interviewing with, we've created a series of videos, one from our graduate medical education department that shows you what it's like at UCSD and goes through each of our teaching institutions. There's also one that we created ourselves with our own fellows called A Day in the Life of an ID Fellow, which gives you a pretty good idea of our day-to-day activities from our fellows' perspective. And then last slide is a great deal of additional information on our website, with our division website, our fellow website, the CREST program, HIV and Global Health Grand Rounds, Center for AIDS Research presentations, IPATH, and virtually everything else that I've covered for you today. So I'm going to stop here, and hopefully you will all have had the opportunity to review this slide presentation before you come or attend your virtual interview. And I'll thank you now for your attention, and be sure to jot down any questions you might have from what I've discussed so that we can talk in more depth about these things when you get to your actual interview. Thank you.